Hello and welcome to the Northeastern University Bioethics Forum. My name is Stephen Wood. I'm an instructor in the Bouvet College of Health Sciences in the School of Nursing here at Northeastern University, as well as a fellow in the Center for Bioethics at Harvard Medical School. And today we're going to talk about the ethics of mandated treatment for substance abuse. So there are an estimated 104 countries that employ some type of mandated substance abuse treatment program, although this is usually compulsory for criminal offenders. To come back to the United States, there are 31 states that allow for civil non-offender mandated substance abuse treatment, but only 20 of those states regularly utilize this. Mandated treatment typically is a civil process, and persons are placed in a state-run hospital or treatment center. There is only one state that actually places compulsory or mandated treatment people into the penal system, and that is here in the state of Massachusetts. So substance abuse is clearly on the agenda here. Worldwide, also here in the United States, we're in the midst of an opiate epidemic, and what that has caused us to do is kind of look at, do we have really good evidence-based substance treatment at baseline? What are we offering? How are we offering it? We're going to look specifically only at mandated treatment. And so for many people, they feel that substance abuse, be it alcohol or opiates, really effective treatment requires readiness. And then when that individual feels that they are ready to manage their substance abuse disorder, their substance abuse disease, that is when they're going to be, treatment is going to be most effective. However, we still see, fairly high rates of recidivism, even for those individuals. And so there are also other individuals who, put themselves and their communities and their families at significant risk because of their substance abuse. And so this is where compulsory treatment has been, kind of derived from. And so when we think about, is there a need for mandated treatment? One of the things that people look at are, well, what are the recidivism rates for people that seek treatment for substance abuse? And this was a study done by Schiff et al. It was published in the New England Journal of Medicine, and it was looking at a program called PARI, which is a police-assisted program helping get individuals who presented to the police department stating that they needed help with substance abuse. They would then be transitioned into a hospital emergency department. They would have some medical clearance. There was a component of peer-to-peer support, and then the ultimate goal was to get them to treatment. And they had a lot of success getting those individuals into a treatment program. But what I've circled here is what is of somewhat importance in that the recidivism rates can kind of be garnered from looking at the data they got from these individuals. And of the individuals that presented to that PARI program, around 18% of them had never been to a detox. 50% of them had been at least once, but up to 5 times, and another 30 to 31% had been over 6 times. So 80% of people had already attempted treatment, but didn't find success with the programs that we had to offer. So another issue for the support of mandated treatment is that there's an economic impact. There's an estimated that we're using, $193 billion are spent on drug abuse, and $223 billion are being spent on alcohol abuse annually. There are about 20 million individuals that are deemed to have some sort of substance abuse disorder, but only about 2% of those people receive any treatment, and less than 1% are receiving that treatment from some sort of evidence-based specialized treatment center. An overwhelming majority of people who need treatment do not feel that they need treatment. So around 95% of people who have an identified substance abuse disorder didn't think they actually needed treatment. And we're also finding that opiate overdose deaths are continuing to rise despite an array of efforts. And those efforts include increasing detox beds, increasing outpatient management, naloxone, and, a number of different efforts, and our overdose numbers continue to rise. This is a look at some data from the CDC from 2000 and 2015, and just looking at how the rates of death from particularly from heroin, particularly from semi-synthetic opioids and other synthetic opioids, are continuing to rise. And when we look at all that data combined, the numbers are staggering for deaths per 100,000 in the population. From 3 per 100,000 in 2000, now we're up to about 10 to 11 per 100,000 just in a 15-year span. So again, more support. Why do we need mandated treatment? Certainly there's some neurobiology behind the need for mandated or compulsory treatment. The substance abuse can affect the prefrontal lobes. This is your executive function. This is where you're making critical decision making, that affecting those frontal lobes can increase impulsivity, meaning that those individuals are less likely to be able to manage an impulse for reuse. Substance abuse affects not only a given individual, but also the community. And we're seeing that here in the city of Boston, right along that stretch of Massachusetts Avenue, or Mass Ave, what we're calling now Recovery Road, where there's a number of individuals engaged in substance abuse. Most of that being that there's a methadone treatment center nearby. The community is affected by that. There's some increase in crime. There's an increase in risk for pedestrian accidents. There have been a number of needles that are continually being found and requiring cleanup. So it does affect that community and not simply that individual. The rights of that individual then need to be balanced with the rights of the community. And is it fair to a community to have that risk of encountering a needle, having a potential for an auto pedestrian accident, or any other kind of issue, or did the rights of the individual surpass that? As I showed you on the slide from Sheff et al., we're seeing that voluntary treatment doesn't always seem to be effective, especially if a person can decide to leave within a day or two of treatment rather than be mandated to a certain period of time. Mandatory treatment seems to reduce harm for the individual and the community, and oftentimes it's free. It's not something that insurance has to pay for. It's a state mandate, and so that treatment can be offered free of charge to a given individual. Parens patriae, the government or any other authority regarded as a legal protector of citizens unable to protect themselves, is often how we can justify the use of mandated civil commitment, in that that citizen has been deemed such that they are unable to make autonomous decisions on their own, and so we as a government or other authority have the legal right to protect them from themselves and from their community. Conceptually, this is different from incarceration in that these individuals are admitted for treatment as opposed to punishment. So they're not being imprisoned. Certainly their rights are being restricted, but the idea is that they're getting mandated treatment because they have been unable to protect themselves, and they've been unable to bring themselves to that idea that they are in need for treatment. Most states that have civil commitment require a number of different points to be addressed before they'll commit someone civilly, and that person has to be demonstrated proof that that person is a danger to themselves, they are a danger to others, potentially a danger to property, and that also they meet the criteria that they are in need of treatment for an addiction to either alcohol, to opioids, to benzodiazepines, or other agents. The client, the other points that have to be made is that the client will likely benefit from treatment, and the burden of all of this proof is generally on the filing agent. And in many states, that filing agent is the patient's family. There are some states where it can be law enforcement. There are some states where it can also be healthcare providers, but for the most part, it's often a patient's family. So let's look then, we have some concepts as to, what are some arguments for compulsory or mandated treatment. Well, okay, they're good arguments, certainly, but, does this work? Does making someone go into treatment actually have benefit to that given individual? This study looked at alcohol abuse, so it's a little bit different than, we can't always necessarily say this is going to correlate to other substances, but at least in a 1-year treatment outcome period, it looked like that mandatory or compulsory treatment did have better outcomes with regard to abstinence or non-problematic use of a substance, but that waned over years, and so at 5 years, in fact there was no difference. And even actually trending towards doing worse. So there are, there's limited data looking at this, but this is one study that looked at it. And while there might be some benefit early, this is, this compulsory treatment, this mandated treatment, its effects seem to wane over time. And so what are some reasons that there may be failure for compulsory and mandated treatment? And those are, kind of placed into the, these are on the patient. So variability of the treatment setting. So if it's compulsory treatment but it's outpatient, or it's compulsory treatment but it's a 30-day versus 90-day inpatient, whether or not there is or isn't medication replacement therapy. So treatment's been quite variable, and so we've never really had just one kind of data set to look at. We don't really even have good evidence based data looking at treatment in general, so we don't know which treatments are going to benefit most people. Oftentimes these are coupled with other mental illnesses, be they anxiety, depression, PTSD, and so these patients often present with a heterogeneous presentation. So we can't have one size fits all, and so it really complicates when we do mandated treatment, how are we going to do it, and do we need to have one kind of mandated treatment that dictates you're going to be there for 60 days and you're getting medication replacement therapy as well as cognitive behavioral therapy, or do we have different types of mandated treatment depending on the individual's given situation? We also don't know what the duration of treatment should be. Should it be 10 days, 30, 60, 90, or even longer? And once you're released from mandated treatment, should we then have ongoing voluntary treatment? We don't really have a lot of data to suggest which of these is going to work best. Many times when you have to mandate someone to treatment, there's lack of motivation for that individual. If they were motivated to get help on their own, then they probably would have voluntarily sought that help. And we know that readiness is an important factor for this. So if there's a lack of motivation, then that individual may not respond as much to treatment as someone who's coming in on a voluntary basis. Many patients often perceive pressure from an outside source, be it a family member, be it law enforcement, be it impending legal issues, and so they see these pressures, and they may allow for this commitment, but it's really, again, they don't have that readiness. They're not open to treatment as of yet. They're just trying to avoid pressures from an outside agency. Some of these programs lack access to mental health programs, and other programs lack access to medication replacement therapy, which is certainly one area where we have seen maybe some positives with regard to people either being able to abstain from using an illicit substance or at least limit their problematic use. So these are all kind of factors that come into play when we're thinking about why some of these mandated treatment programs, why compulsory treatment might fail. On top of whether or not it works or doesn't work, we also have to think as to whether or not mandated and compulsory treatment is ethical. Can we actually take someone and civilly commit them to a treatment program really without their permission? And so we're going to look at some of these tenets of bioethics and kind of work through them and see if mandated treatment actually can pass the test of being an ethical treatment. So the first is autonomy, and that's a right or condition of self-government, especially in a particular sphere. It's the freedom from external control or influence. what we consider our independence. And so when you think about a civil compulsory or mandated treatment, certainly it doesn't feel to me that it meets autonomy. Autonomy means that I have a right to decide whether or not I feel I do or do not need treatment, and unless there's really some other overwhelming reason, I should be able to make that decision as to whether I do or do not want treatment. Beneficence is the doing of good, the act of goodness or kindness, of charity. And when we think about it in this context, what we're talking about is, we're looking at, can we do some good for this individual if we mandate them to treatment? And I think you can certainly argue that compulsory mandated treatment can be of benefit to certain individuals. Again, do we have the data? Do we have information stating that mandated treatment was beneficial to this group or to that group? Really, we don't have that information. We don't have that data. But if you think about it just from a kind of empirical sense, mandating someone who's using drugs to the extent that you feel they're a danger to themselves, there probably is some beneficence in doing so. Non-maleficence is non-harming or inflicting the least harm possible to reach a beneficial outcome. There's a lot of kind of crossover or confusion between the difference between beneficence and non-maleficence, but in this case it's are we doing any harm? So are we doing harm by mandating someone to treatment, to mandating them to a compulsory treatment program that maybe wasn't their decision? And I think there are a lot of harms that can be both perceived and actual to individuals who have to undergo this treatment. And when I've spoken with patients that have been mandated to treatment, those harms are that they've been removed from their culture, from their community. They may have loss of jobs. They may have loss of family contacts. They may have been taken out of a program that slowly was working for them and all of a sudden changed them to a completely different treatment strategy. And so certainly you could see where there are some harms to mandated treatment as well. And then finally, justice. This is, people think of this more as a legal term, and it really, it's the maintenance or administration of what is just by law, by culture. This is going to vary by location and by culture and by law. Are we doing something just by, morally right by mandating someone to treatment? And we'll kind of look at that a little bit more when we look at the Massachusetts example specifically. So that brings us to the story here in Massachusetts, and how mandated treatment and compulsory treatment has been working here in our own state. And so here in the state of Massachusetts, we have something called the Section 35, and that is a civil commitment when a family or a healthcare provider predominantly feels that someone's at such significant risk from their substance abuse that they are in danger of immediate harm. And so just to use some recent data, between July of 2016 to July of 2017, there were 11,000 requests in Massachusetts for a Section 35 civil commitment. Of these, 6,400 were approved. And then 2,266 of those individuals entered our penal system as overflow to what is our mental health treatment capacity. And we're using currently the Plymouth County Prison House to maintain the Mass Alcohol and Substance Abuse Treatment Center for Men. So of those requests, almost 2,300 individuals went to what can be considered a prison. This is what the outside of the Plymouth correctional facility looks like. So if you're thinking you're going to get help with substance abuse and you're walking in and seeing barbed wire fences, I think you're having some doubts about the effectiveness of your potential treatment. And then this is a room at one of the in that facility. You can see that the windows are barred. This is basically how you're housed in a prison. Very little in the way of any comforts at all. And you're wearing an orange jumpsuit, and you have a little plastic bag that says inmate on it that you carry all your belongings. you've been civilly committed, but there's no doubt that your placement has been into a prison type setting. So these are locked facilities. As I mentioned, these patients wear orange jumpsuits. They carry laminated pouches that say inmate, and they all have to abide by prison rules. They can't have any visitors. There is no access to medication replacement therapy, which is certainly at least has some evidence that it has potential for benefit in the substance abuse population, and they have very limited access to mental health care. There's been some efforts to rectify that, but personal stories have been that they didn't see anyone who could provide any cognitive behavioral therapy or other mental health care 5, 6, 7, 8 days into treatment. Here are some quotes from some individuals that were there, as well as some people who've kind of looked at the Massachusetts experience. And so Leo Beletsky, from the School of Law here at Northeastern University, he's a professor in law and health sciences. His statement is that theoretically, mandated and compulsory treatment should be just like a hospital. You go in, you're given a full spectrum of care, but instead our system is a prison or a warehouse. This is a statement from one of the patients who was on a Section 35. It says, "That place is brutal. People don't understand. The place is literally a prison. They treat us worse than they treat the inmates. And when you lock somebody up, it changes the way people look at their treatment." But here's the sheriff who runs that facility, Sheriff Coven, asking what's the alternative? Just letting people overdose on fentanyl and die? What you really need to do is look at the families who are terrified. The kids overdosed 5 times in the last month. They find their kid on the floor with a needle in their arm, and the families are desperate. So certainly, some fairly disparate thoughts from all different sides about how mandated or compulsory treatment works here in Massachusetts. So why then does mandated treatment fail? Well, I think one of the most important things for someone who is experiencing issues with substance abuse is that for them to be open to treatment and for treatment to be effective, you need to have readiness. They need to be ready to say, I have a problem, I've identified this problem, and I want to get better. Well, mandated treatment kind of strips that away. Mandated treatment lacks autonomy and actually doesn't allow for any input of preferences or desires for how that individual might want to get better. They may want to have an inpatient treatment and feel that's the only way they can do it. They may feel abstinence in going to AA and NA meetings. They may prefer an outpatient treatment, or others may prefer CBT coupled with medication replacement therapy. But when you have a mandated or compulsory treatment, you're put into one track and it's one size fits all. As I mentioned earlier, it can be harmful not just to the person but to the family, and we're really we're framing treatment as punishment. And so in this way, it's unjust. Mental health isn't a crime, it's a disease. Substance abuse isn't a crime, it's a disease. And so if we place someone into a prison and they're treated like a prisoner and they're not offered the same treatment potential of an individual who's hospitalized in a specialty center, then we're incarcerating them. And so it's unjust in that way that they aren't getting the appropriate treatment that they need. In our case, we do have some hospitals that specialize in this, and others patients are put into the penal system, so it's not always carried out in a facility that can manage treatment. And so when you have that situation, then you're really not providing anything for that given individual. Oftentimes there are a lack of resources, so access to mental health counselors or other social workers really is non-existent because of the lack of resources. Many of these patients, especially if they're going into a penal system, don't have the opportunity for medication replacement therapy, and really we don't have any data as to whether or not compulsory or mandated treatment is of benefit to to individuals. We haven't studied this longitudinally to see if putting someone into a compulsory treatment actually is of benefit or if there are potential harms. We don't know. We just don't have the data, and no one's collecting that data to date.